In this video, I want to talk about cartilage injury and why healing of cartilage can be really difficult and how an emerging treatment might help more than anything we've had in orthopedic surgery, and that's exosomes. My name's Dr. David Geier, triple board certified orthopedic surgeon, sports medicine specialist, and anti-aging and regenerative medicine expert. I help you feel, look, and perform your best regardless of age or injury. Before I start, I want to say, as I always say in these videos, this is not meant for medical advice in any way. This is meant only for information and educational purposes, especially when we're talking about regenerative orthopedic treatments. These are considered experimental by the FDA. I want to make that very clear. I'm not promoting them. I'm not telling you that you should do them. I just want to put the information out there, try to explain them in ways that everyday people without orthopedic knowledge can understand, so that you can potentially talk to your doctor and make the best decision for you. I'm not trying to promote the treatment, not trying to promote my practice or anything like that, but I do think these should be helpful to help you make a better decision. Now, let's go to cartilage injury first. This can be damage to the cartilage from trauma, sports, overall wear and tear like we see in osteoarthritis, but this is basically the soft tissue cushion of our joints. The problem with cartilage, very limited blood supply, so it just doesn't heal. Over time, that leads to pain, that can lead to stiffness of a joint, decreased motion and mobility of a joint. And the traditional treatments, whether that's just rest, physical therapy, anti-inflammatory medications, injections like steroids, even surgeries like microfracture, they're treating the symptoms. They don't regenerate or repair the cartilage effectively. You're treating symptoms, you're not treating the underlying cause or the underlying problem. That's where something like exosomes come in. So before we talk about how they potentially help, let's talk about what they are. These are little, very, very little, microscopic little vesicles inside of stem cells. Some people call them microscopic bubbles or microscopic envelopes. They're secreted by a cell, in this case, stem cells, and they come from bone marrow stem cells, adipose tissue stem cells, or in the treatments here, they come from umbilical cord, amniotic fluid, things like that. But these extracellular vesicles, they're packed with these bioactive molecules, whether that's proteins, lipids, number of different things that facilitate cell-to-cell communication. Now, unlike stem cell treatments with exosome injections, there's no cells. So you have the healing signal without the actual cells themselves. In theory, there's reduced risks to that. In the theoretical risks of immune rejection of stem cells or tumor formation that potentially come with stem cells. Now, back to cartilage injuries. How would exosomes potentially help? Well, if they're injected directly into the joint, which is what you would potentially do, they target the damaged areas and try to promote regeneration of that cartilage. They modulate the inflammation going on, stimulate cartilage cell proliferation, chondrocytes specifically, proliferation to enhance cartilage healing. They also enhance production of what's called the extracellular matrix. It's a scaffold that basically holds the healthy cartilage cells together. They inhibit mTOR and other damaging pathways to cells and are involved in sort of cleanup of the area to prevent further degeneration. This has been looked at, and I've done another video on exosomes and osteoarthritis, so there's a little bit of overlap here, but the early studies have been very encouraging. Reduced pain, improved joint function, actually showing at a cellular level improved cartilage repair, including what's called hyaline cartilage repair, which is a little different than the fibrocartilage that the microfracture surgery typically creates. These have been mostly animal studies. There was a study looking at rats showing enhanced extracellular matrix production, and again, pain relief with decreased inflammation. The human trials, the human studies are very early, but we're starting to get there, at least to a certain extent. There was a study very recently, a human trial looking at bone marrow-derived exosomes, showed significant pain reduction, better joint function after 6 months, really no side effects. So these early preclinical studies looking at chondroprotective effects, basically reducing some of the formation of osteophytes or bone spurs, and again, modulating the immune response in the joint environment, hopefully to prevent progression of osteoarthritis issues, potentially very, very exciting. Another area that's being looked at is would exosomes, in addition to either scaffolds or hyaluronic acid or these hydrogels, even better help cartilage repair? And that's something we're going to see in future trials. Again, this is not ready by any stretch of the imagination to say how this is a miracle cure for cartilage damage and osteoarthritis. We're not there yet. This is experimental. They are not FDA approved. So that is important to know. We need large scale human trials to, especially long term, to know safety, to know efficacy. I think that is very, very important. Also, is this going to be something that you need one injection, or what a lot of people think we need multiple injections due to the short half-life and the variability depending on where the exosomes are derived from? Not approved by insurance, so cost is certainly going to be an option. But what we see so far, minimal, if any, injection site reactions and any other kinds of reactions. So in that sense, so far at least, it's been proven to be very safe. This is an exciting potential regenerative step forward. Hopefully, non-surgical cartilage repair is something that we can talk about in the coming years. Again, using the body's own healing mechanisms and just enhancing that. So it may be something worth talking to your orthopedic surgeon, to a cartilage specialist, to see if this is something potentially right for you. Again, just know that I'm not promoting this or promoting my practice. This is experimental. I just want you to know more about what is out there and what's coming. All right, if you want a copy of my ebook, The Arthritis Solution, you can get that free. Just click the link for it in the description below this video. If you have an orthopedic injury and you want to hear about options more than the traditional options, more than surgery, more than cortisone shots, you can click the link in the description under this video. It takes you to a contact form. You fill that out. You can potentially schedule an appointment to see me. Also, I'd love to hear about your experience with your injury. Leave those in the comments below this video. Just understand, if you leave a question in the comments, I can't respond and give you medical advice. So what I do sometimes is I create another video answering that question. Also, click the bell up top when you subscribe to my channel. That way you're notified when I release a new video and when I start my Ask Dr. Geier live shows. Thanks for watching. I look forward to helping you feel, look, and perform better than ever.